Hey everyone, welcome back. A very exciting study just published on how to treat SIBO with natural agents. It was actually an integration of natural agents plus antibiotics. What is so novel about this study is it helps us better understand how to use the tools in the treatment of SIBO. There's really no shortage, in my view, of information about the tools, what the tool is, what it can do, but how we use these things, how we sequence diet, probiotics, antimicrobials, other supportive or leaky gut treatments, how do we put those together into a treatment plan that's effective? And that's where this paper, published in Nutrients, comes in. The title, Do Herbal Supplements and Probiotics Complement Antibiotics and Diet in the Management of SIBO, a randomized control trial? What did they find? What did they do? Well, the rationale behind the study from the authors is wanting to better treat SIBO because of the high rate of relapse. The authors cite one study that found a 44% relapse rate within a 9-month period after treating SIBO. And sometimes relapse is labs, sometimes it's symptoms, but nevertheless, there is a often reported regression of symptoms. So what can we do to better assess what natural tools can be integrated into a care approach? So the setup of this study, and I'm not going to go through all of the details, but what I feel to be the most important. So 123 patients with methane SIBO as diagnosed via a lactulose breath test were given one of two treatments, sort of your standard and then the standard plus integrative or natural therapies. So the control group, the standard group, antibiotics plus a low FODMAP diet. So that's the one treatment. In the other group, they also got the antibiotics, a low FODMAP diet, probiotics, herbals, and glutamine. We'll go into more detail about the protocol in a second, but what did they find? After 3 months, they found that both groups had similar gas levels. And actually, that most in both groups did not achieve normalization of their breath test. But here's the key point. 60% in the medication group saw a resolution of their symptoms. 78% saw a resolution in their symptoms when they added the natural therapies along with the antibiotics. Why I think this is so important harkens back to a principle that we've been trying to develop for a while, which is we want to look at symptoms over labs. And so in this case, if you are only looking at your labs, most people didn't normalize their labs, but 60% and 78% saw resolution of their symptoms. And I was actually consulting with someone just yesterday who had been to one of the preeminent research centers in the US for SIBO, and she was griping that she felt like her doctor there, as well-intentioned and as kind as he was, didn't really listen to her and her symptoms, but just wanted to keep treating the labs. And that's a mistake in my view, because at best, these labs are only giving us a slice of what's going on in the gut. So we really want to use symptoms to steer the approach when it comes to SIBO care and gastrointestinal symptoms for the most part, in my view. And by the way, if this has been helpful, please comment and subscribe. I really do appreciate hearing what people think, so I'll look forward to reviewing your comments. Okay, so the protocol. As I said before, the medication group was given rifaximin and neomycin for 10 days. The group that had the combination had those medications plus a low FODMAP diet, and I wanted to cue in on one item about the low FODMAP diet here. So this is where we'll kind of go into a little more detail of the components, right? Because remember, there was low FODMAP diet, probiotics, herbals, and glutamine. So with the low FODMAP diet, they used the Monash app, and they did the low FODMAP diet for 1 month, but then over a 2-month period, they reintroduced. And that's what you're seeing here in this diagram. Low FODMAP for a month, and then for the next 2 months, they reintroduced. Now, why this matters is because you don't want to stay on the low FODMAP diet in perpetuity. And I think what ends up happening in a lot of these situations is people aren't sure where their symptoms are coming from. And so when in doubt, they sort of cut it out regarding foods. And I understand where that comes from, but there is a balance here to be struck, meaning if you're not sure, and so you just cut, people can be overly avoiding food. Now, if we're getting the treatment right, what should be happening is progressive resolution of symptoms over time with improved dietary tolerance. So we just want to be attentive to the strategy is not always more restrictive dieting is better. So unless you've clearly noticed in a repeatable fashion that a food triggers you, you may want to be a little bit careful with the when in doubt, cut it out, and think about a reasonable application, a month or two, let's say, on the diet, and then start broadening and reintroducing. I also will acknowledge that that is much easier to do when you feel like you're improving. And if you're not improving, that's when things get a little bit more murky. But nevertheless, I think just having this paradigm of not considering all foods guilty until proven innocent, but rather consider them innocent until proven guilty in the sense that you've clearly noticed that this food elicits a symptomatic response. So diet, low FODMAP, 1 month more directly, and then a reintroduction for the following 2 months. Regarding probiotics, they used Saccharomyces boulardii at 5 billion CFU per day. And if you look at our evidence-based probiotic protocol, you see that for Saccharomyces boulardii, that's not a very high dose. In fact, we could have, or one could have tripled that dose, and maybe the results would have been even better. But nevertheless, 5 billion CFU of the Saccharomyces, and with the other probiotic, it was a lactobacillus and bifidobacterium blend at a dose of 2.5 billion CFU. So that is within the range, but it's also at the lower side, which is fine. All I'm trying to articulate is there may even have been more potential gain to be had if a higher dose was used. Higher indiscriminately doesn't mean better, but higher within the ranges used across many studies, as you're seeing here in our evidence-based protocol, might have led to even more improvement. So that's the probiotic piece, Saccharomyces boulardii, along with a few lactobacillus and bifidobacterium. The herbs they used, a blend of oregano, cinnamon, peppermint, lemon oil, and wormwood. And as we have shared before, we have been developing painstakingly this table that lists a number of different botanicals or herbs and the various microbes that they target. And what I want to flag for you here is one of the reasons why I love herbal medicine. Look at wormwood or Artemisia. It can combat SIBO. In fact, we'll be updating this table in light of this podcast. But it also can fight Candida, Babesia, and Borrelia. And with cinnamon oil, it can hit Borrelia, Bartonella, Babesia, and Candida. So the point I'm trying to make here with these different agents is that they have action, the herbals, against multiple organisms. And why that can be so helpful connects to a study published by Satish Rao, 2013. In people with digestive symptoms of no known cause, he found 20% had SIBO, 20% had Candida, and 20% had both. So this might be part of the reason why we see better results in some people when they go beyond just antibiotics, because the antibiotics will address the bacteria, but if there is Candida at the same time, the antibiotics won't. Now you can get around that by adding something like fluconazole or nystatin, or an herb that can hit both, or even more in this case, if there might be some other type of organism outside of SIBO and Candida. With the diet, the probiotics, the herbals, they also used glutamine. Glutamine used at a dose between 10 to 15 grams per day, I feel to be the best dose. So this is a great study in the sense that they really utilized what many natural providers have been doing for years and years and years, which is a more comprehensive, multi-pronged approach. And that was evidenced by the 18% higher resolution rate of symptoms in the group that had the more comprehensive treatment plan. So then a few takeaways from this study. Firstly, as I've said so many times, but it's always worth repeating, don't stress over your labs. Put your symptoms over the lab results. I try to always be careful in stating that doesn't hold everywhere. If you have diabetes, if you have hypothyroid, if you have high blood pressure, a lot of these things are really a lab-centric treatment plan, meaning you're monitoring the labs. With the gut, because the tests only give us a small sampling of what's going on in the gut, I feel it's best to use those as a secondary data point. And the primary data point is the individual and their symptoms. Second takeaway is synergy seems to equal success. And I've said this, going all the way back to Healthy Gut, Healthy You, that the difference between success and failure in some cases is just having a more comprehensive plan. Did you just have antibiotics for SIBO? Or was it antibiotics plus diet, maybe even plus probiotics, plus herbs, plus glutamine? This holistic approach really helps to repair more comprehensively the ecosystem and all the multitude of ways in which dysfunction can occur in that ecosystem. And I just want to make a note here that if you don't favor antibiotics, and I'm agnostic regarding antibiotics, I'm totally open to them, but I do think it's important to keep calling out this growing body of research that has demonstrated in many different cases that when we compare antibiotics or antifungal drugs to various herbs, we see equivalency of the results. And the one hallmark study for SIBO was the Jerry Mullen study in 2014 that found herbals were as effective as antibiotics for SIBO. You can use both. You can use them literally at the same time, like this study did. But just for the people who might be apprehensive about the antibiotics or just do not want to use them, this gives you all of the option or all the options at your disposal. The final point I wanted to make was, what do you do if you have persistent or non-responsive or relapsing SIBO? Well, firstly, I think it's crucially important, coming back to my earlier point, to ask, is this really SIBO? Is it SIBO that's causing my symptoms? And just like I was sharing with the individual I was consulting with the other day, sometimes if you just keep treating the SIBO lab, the dead end is just in that. So maybe it's not actually SIBO, maybe it's constipation. And so in this case, something like a fiber supplement, Prokinetics, abdominal massage could be helpful. Or maybe your symptoms aren't coming from SIBO, maybe they're coming from Candida, or maybe there's some sort of other infection. We've been discussing on the podcast of late how these vector-borne microbes, things that can be passed by cats and fleas and ticks and certain mosquitoes and other biting flies, may be the cause of non-responsive symptoms, especially if you're seeing multiple systems involved: brain, skin, joints. And Erdman published a study that found about 50% of his patients who had chronic non-responsive gastrointestinal symptoms and or SIBO actually had one of these other microbes present. One of the ways that you can cue in on this is if you have done antimicrobial therapy of any sort and you had a pretty pronounced die-off reaction, meaning you had fatigue or joint pain or brain fog, then that may indicate there's something beyond SIBO. Because at least in my experience, and there's a few clinicians who have confirmed this also, SIBO doesn't seem to be a big driver of die-off. So something to bear in mind, if you do have die-off, there might be more than SIBO present. The other point I wanted to make for persistent SIBO is, are you using probiotics? Again, borrowing from this patient I was speaking with the other day, coming from this major research center, they were very do not use probiotics, which is a travesty because the data is really different. The data supports at least a trial on probiotics for the use of SIBO. This study is one of many, a case in point supporting that. Okay, so in recap, I think the most important concept to take away is that synergy often equals success. So I would recommend starting with dietary changes, perhaps low FODMAP, but for some people, different diets work better, like a Candida diet, plus probiotics. And maybe if you want to add in some glutamine or other leaky gut supportive nutrients, this is a good step one in my view. And then the second thing to consider would then be going to herbal antimicrobials, antibiotics, or both. And my rationale behind that comes from the fact that when they're combined together, the probiotics and sort of dietary changes, along with the antimicrobial therapy, whether it be herbal or antibiotic, when they are combined, the success rate goes up quite a bit, about 30 to 35%, looking at what's been reported in some of the systematic reviews. So then it begs the question, well, do I do both of them at once? You could, but for some people, that's going to be unnecessary. The diet plus a good clinical dose probiotic protocol plus things like glutamine or other gut supportive supplements will be enough to resolve symptoms in some. So you want to give that a month or two or so. And then if you're doing really well or fully resolved, you can stop there. If you don't think you're hitting quite the response rate that you should be, that's when you're very well positioned to add in the antimicrobials. Again, in my view, get the most out of them when using them at that point in time. Okay, well, again, I hope this helps. And until next time.